on behalf of a group of clinicians and researchers at the Children's Hospital and Simon Fraser University on some research that we've done on a group treatment for children with autism and anxiety. This is an area of passion and a strong interest of mine, as a portion of the data from this program of research I'm using for my dissertation project. So there are some very skilled clinicians in the community and in this room who offer treatment services for children with autism and anxiety, and yet there's a need for even more community-based treatments for these youth, given the high levels of needs that have been identified. I'm also going to outline some of the barriers to making this kind of treatment more widely available within the community and provide a bit of an overview on the research that we've been conducting at Children's Hospital on the real-world effectiveness of a CBT group for anxiety treatment in this youth. I'd like to provide some practical information as well as next steps in order to further facilitate community involvement in this regard. So as mentioned, there's a high need for treatment in children with youth with autism and anxiety, with an estimated 40% of children in this population experiencing clinical levels of anxiety at some point. According to the National Needs Assessment Survey by Dr. Weiss, who was our keynote speaker today, and his colleagues, approximately 25% of school-aged children with autism in BC receive a formal diagnosis of anxiety. However, appropriate mental health treatments are not always readily available within communities, and 25% of Canadian caregivers of children with autism describe mental health treatment as being difficult to obtain. And there are a number of barriers that have been identified by families and clinicians for accessing mental health treatment services. So this includes a lack of community resources offering evidence-based treatments, but it also includes being on a wait list, not being able to afford certain treatments, a lack of trained professionals who specialize in mental health treatment, for example, and autism, age group restrictions on the types of services that are being offered, and being either too young or too old for certain services. Finding appropriate services and having community awareness about these types of services that are offered within communities, such as knowing that BC Children's Hospital offered a group treatment for treating children with youth with anxiety, and getting the information out there so that practitioners know to make referrals and families know to ask their pediatricians and other healthcare providers for referrals to participate in this program is an important piece. Transportation and acknowledging that these types of treatments don't occur in all of the communities is really important to acknowledge as well. We had families traveling from as far as Abbotsford and Chilliwack, so that's up to 2 hours per way to attend treatment at the Children's Hospital. And so that's a real big and important factor to acknowledge for families. Childcare and potential time off work, if this is happening, is also an important thing to consider. And attending regular treatment sessions in and around the things that families are already doing for their children, the activities and treatments that they already have going on, is also a barrier to acknowledge. Barriers that have been identified for clinicians include a significant gap between the knowledge derived from research studies and clinical applications in real-life settings, and an overall need for more effectiveness research within community environments with complex populations. Clinicians have the large job of sorting through and selecting research-based treatments and finding up-to-date materials, which can be cumbersome. Training programs in autism don't always thoroughly cover mental health issues in a way that's very comprehensive, and training programs in mental health don't always cover in a thoroughly and comprehensive way autism. So there's not often a cross-fertilization of the two areas covered and represented formally in many training programs. There's also a number of costs associated with administering these types of treatments, and a need for appropriate spaces to run groups, and groups that have breakout groups, so needing multiple rooms. And there's a number of appropriate screening and matching to type of treatment that needs to take place that all requires resources and coordination, so there's barriers on both sides. However, although the barriers exist, there have been large advances, as alluded to by Dr. Weiss and Grace, Dr. Yirochi. I can say Yirochi too. In the last 10 to 15 years, in terms of treatments that we know works for this population. So one of the treatments considered to be evidence-based for treating anxiety in children with autism is CBT, cognitive behavior therapy, which is a therapeutic model that involves changing patterns of thinking and behavior that are causing or maintaining difficulties for the youth, which then results in some changes in feelings such as decreased anxiety and increased problem solving and skill development. The programs often include psychoeducation, cognitive restructuring, which is changing thinking patterns, also anxiety management skills like relaxation training, and exposure treatments is absolutely key for treating anxiety in typically developing youth and in youth with ASD, which involves a step-by-step graded exposure to facing fears. There are also a number of recommendations for modifications of CBT for children with autism, which is another area that's a strong interest area for me, and I understand we'll have a chance to talk about this more tomorrow. But this includes things like using visual materials, having detailed parent curricula, and using video modeling and various activities to aid in generalization. And although CBT is most often delivered individually, there are many group treatment protocols that are now kind of coming to fruition, including one developed by Dr. Judy Reven and her colleagues, and that are very promising. And this is the research that we've been conducting at BC Children's Hospital that I'll talk about in a few minutes. So there are a number of advantages to conducting group-based treatments, and these include opportunities for normalizing experiences, opportunities for social supports, decreased isolation, what I like to call the Me Too effect, where children who are sitting across a table from other children who are just like them, sometimes for the first time describing their fears and hearing, "Me too," and feeling not alone for sometimes the first time. We hear that routinely from parents who've participated in group with their children, and I think that's a really powerful thing to consider. It's very destigmatizing. Group activities can make for enjoyable learning experience as well. We made a lot of videos and did our own video modeling type program in the Facing Your Fears program. And I've never had so much fun in all my life sometimes. We've laughed so hard. And it's been a really enjoyable learning experience in a way to aid in generalization. It's also provided opportunities for vicarious learning.